Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Today we're talking about sexually transmitted diseases. According to the Centers for Disease Control and Prevention, roughly 20 million new cases of sexually transmitted diseases occur every year in the U.S., with 50% of the cases occurring in people ages 15 to 24. And sadly, the number of cases is on the rise. Here to talk about sexually transmitted diseases is Dr. Ronald Salzetti. He is an OBGYN, obstetrician and gynecologist at Scripps Clinic in Rancho Bernardo, California. He is also the chairman of the Department of OBGYN at Scripps Clinic. Thanks so much for joining us today.
Thank you, Susan. I'm happy to be here.
Let's talk about the most common types of STDs. Let's start with chlamydia because the numbers are staggering. 1.8 million cases, a 19% increase since 2014. What is chlamydia? What are the symptoms? How do you get it?
Yeah, it really is a new epidemic that's going on right now. We're seeing cases, I've diagnosed more cases of chlamydia in the last couple of years than probably the 10 years before that. And chlamydia it's a small parasitic virus that infects the cells of the cervix. It's sexually transmitted. It can happen through oral, vaginal, or rectal sexual intercourse. And it can range from minor infections that are easily treated with antibiotics to major infections which require hospitalization and can affect future health.
What are the symptoms?
The symptoms vary. They can be no symptoms at all, and so that's why it's important to get screened. We now screen all young women at every annual exam, and we screen everybody at their first prenatal visit because it's very important to get it and treat it as early as possible. The most common symptoms with it are a vaginal discharge and often pain, especially with intercourse. But in severe cases, it can cause severe abdominal pain. It can cause an infection that requires hospitalization with fever, chills, even rigid abdomen.
Can men get chlamydia?
Men can get chlamydia, and it's passed between. Men typically have less symptoms, and that's why it's often transmitted. Men may get a urethral discharge, a discharge from their penis, may get some pain with urination, but often don't have any symptoms.
All right, let's talk about gonorrhea. 405 cases, a 63% increase since 2014. What is gonorrhea?
Gonorrhea is another bacterial infection. This is a little bit larger bacteria, but the symptoms are remarkably similar with gonorrhea and chlamydia. They often range from no symptoms at all to minor discharge and pain. It can also cause severe infection like pelvic inflammatory disease.
And you get gonorrhea?
Also through sexual contact, and any oral, anal, or vaginal intercourse can transmit gonorrhea.
Okay, let's talk about syphilis. What is syphilis?
Syphilis is another bacterial sexually transmitted disease, but it's a little bit different in how it presents. Syphilis actually has 3 phases in its presentation. The first phase involves a very tender, painful ulcerative lesion in the genital tract. It can happen near the vulva, vagina, or inguinal area in women, and on the penis or in the inguinal area on men.
What's inguinal?
The groin area where your thighs kind of attach to your torso.
Okay.
That lesion will go away on its own without treatment, so it's important if you've had a lesion like this to go in and be tested, and catching it early on makes a big difference. If it goes on more than 4 to 6 weeks, it can turn into secondary syphilis, and those symptoms involve a general rash over the body that can look remarkably similar to measles and kind of a diffuse flu-like symptoms, but that will get better on its own also, and after that, syphilis doesn't have any more symptoms. So people could go years undiagnosed if they don't get checked with either of the first 2 stages.
What is congenital syphilis? Because there's a 185% increase in that since 2014.
Yeah, and with the increase in moms having more syphilis and not getting treated, we're seeing more transmission to neonates, to newborn babies, and it can be a disaster. Gonorrhea and chlamydia will not transfer to the baby during pregnancy, they transfer at the time of delivery, and so we can treat the babies at the time of delivery and prevent bad outcomes. Unfortunately, syphilis can cross the placenta and be transferred to the baby in utero. It can affect their bones, their liver, their soft tissue, even their neurologic system, and cause symptoms that range from minor to even fatal symptoms. There was a 40% increase between 2018 and 2019 in the number of babies that died shortly after birth due to congenital syphilis.
And what is tertiary syphilis?
Tertiary syphilis is that third of the stages we talked about, going from the painful lesion to the rash to the stage where there were no more symptoms. During that stage, the bacteria is still in your body, but it's now affecting your liver, it can affect your heart, it can affect your neurologic symptoms and do long-term permanent damage to any of those symptoms.
And among newborns, syphilis cases increased 40%. And syphilis in newborns is a tragic consequence of this STD epidemic.
Yes, it can have significant effects on the newborn, ranging from mild skin or bone lesions all the way up through severe neurologic consequences, causing long-term mental disabilities, and it can even cause death in the newborns.
What about herpes, genital herpes, and the cold sores in your mouth?
Yes, both are very important, especially around pregnancy. Genital herpes, if a woman has an active genital lesion at the time of delivery, the genital herpes can be transferred to the neonate, causing a pneumonia or even systemic herpes infection that can also be lethal.
So when you say neonate, you're talking about the newborn?
Newborn, yes, thank you.
Sure.
With herpes, if a woman has a lesion, when either their bag of waters is broken or they're in early labor, we recommend a C-section to bypass the genital tract.
And what about the cold sores in your mouth, that type of herpes?
Yeah, cold sores are transmitted also to babies, so just by kissing a newborn baby with an active cold sore lesion, or by being around a baby with sharing bottles or things like that, can transmit the virus, and it can again have significant effects, as minor ones as that baby having cold sores when they get to be an adult, to as major ones as, again, systemic infections that can cause pneumonia and other illnesses.
And there are bacterial STDs and viral STDs. What are the other viral STDs?
In addition to herpes, other viral STDs include the hepatitis B and C in particular, can be transmitted sexually, and then the HIV virus.
Hold this thought. We're going to come back and talk about this in a couple of minutes. If STDs are left untreated, what can happen down the road? Some pretty major things. So we'll come back and talk about that in just a few minutes. Can antibiotics cure STDs?
The bacterial STDs, the ones we talked about initially, the gonorrhea, chlamydia, and syphilis, can all be cured, especially if caught early with proper antibiotic therapy. The viral STDs, we don't have a specific cure for, but they can be treated, and the chances of transmission to partners or a newborn baby can be significantly reduced.
What's the correlation between illegal drug use, specifically heroin and methamphetamine, and syphilis? Because between 2013 and 2017, there was a 155% increased rate of syphilis among women. During the same period, methamphetamine, injection drugs, and heroin use also increased substantially among women and heterosexual men.
Yeah, there's no question that these two things are correlated. The statistics just bear this out over and over again. As drug abuse goes up, so do the incidences of STDs. And especially, there's multiple reasons why this may happen, but we've seen, especially with injectable drugs and heroin in particular, sharing needles can certainly transmit STDs like hepatitis and HIV, but it's the whole culture around it. We see more unprotected intercourse. We see more prostitution, both in men and women who are involved in drugs to raise money for their habits. And all of those, the lack of safe sex practices and the sharing of needles, both lead to an increase in these infections.
Okay, we referenced this a couple of minutes ago. Let's come back to this. If the STDs are left untreated, what can happen down the road? Some pretty severe stuff.
Oh, absolutely. There's some significant long-term consequences of untreated STDs. Gonorrhea and chlamydia in particular increase the risk of what we call pelvic inflammatory disease, a disease of the pelvic organs, which can result in long-term infertility issues. And even if it doesn't cause infertility, pregnancy after an infection with an STD can increase your risk of ectopic pregnancy or preterm birth. With syphilis, we talked about about with tertiary syphilis, there's effects on the liver, on the heart, and on the brain, causing dementia, causing heart failure, even causing liver failure.
And blindness too, right?
Blindness is also one of the side effects.
Hearing loss.
Mm-hmm.
So what can you do kind of across the board to prevent you from getting an STD?
Yeah, it's all about vigilance. The first thing starts with safe sex practices, making sure that if you have a new partner, you use condoms. Once you've both been screened and are in a stable relationship, or especially deciding to have children together, then you can move away from that, but really practicing safe sex, not sharing needles with anybody. There's a number of programs around for IV drug abusers to have access to safer products if they need them. And then getting early screening. Once a year at your annual exams, asking your OBGYN to screen for STDs, especially at new OB. It's standard of care for every woman at their new OB visit, hopefully within the first trimester, to be screened for STDs. If we get these treated early in pregnancy, we can help prevent transmission to the newborn baby and help prevent a lot of the long-term bad sequelae for both the pregnancy and the baby afterwards.
And if you've got the cold sore, what should you do in terms of being around people?
Yes, absolutely. With cold sores, you just, no matter how much you want to kiss that baby, you can't do it. And that we do have antiviral medications that can help shorten the time cold sores are out and infective. So speak with your doctor about getting on one of those medications.
When should you go to a doctor and say, you know what, I really need to get tested for this stuff, or there's something wrong here?
Yeah, there's a couple of different times. If you've got a new partner, it's good for both of you to get in and see your individual doctors and be screened at the beginning of a relationship. Once a year at your annual exams, perfect time. We talked about at your first new OB visit, mandatory time. And or anytime you have the least suspicion. If you have a suspicion about it, get in and get tested.
Any final thoughts, doctor?
Really, the keys are early diagnosis. With any of these diseases, we can decrease those bad outcomes if you just get in and see us and we get this diagnosed and taken care of for you.
Dr. Salzetti, thank you so much for being with us.
Thank you, Susan.
We appreciate it. If you'd like more information on sexually transmitted diseases, please click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us. It's our mission at Scripps to help you heal, enhance, even save your life.